Well, good afternoon, everyone. I'm Marilyn Howarth. I'm the Deputy Director of the Philadelphia Regional Center for Children's Environmental Health and the Director of Community Engagement at the Center of Excellence in Environmental Toxicology. This is our joint seminar for Climate Week. Both centers funded by NIEHS are focused on environmental health. And so today's topic of impacts of heat on health in early life is consistent with our joint missions. I'd like you to hold questions until after our two presenters have completed their presentations. If there are questions that you think you might forget and you would like to just put them in the chat, that would be great. You will also see in the chat an invitation and a link to additional seminars. Should this one in environmental health be of interest to you, feel free to sign up for our future seminars. Heat in Philadelphia is obvious. I mean, we have more and more days that are hotter. Even if you look at the variability among the numbers of days that are above 90, and you see this year, the number is not quite as large as it has been. If you then look at the number of days that are between 85 and 90, you see why it felt like such a hot summer, because in total, we had more than 60 days over 85. That's pretty hot. The trends show that whether you're looking at the winter, the spring, or the summer, the average temperatures are increasing. And when we consider all weather-related fatalities, heat represents and has represented the largest contributor to weather-related fatalities in our history. We're well aware of some of the diseases that adults can actually have related to extreme heat, with heat exhaustion, heat stroke, worsening of underlying medical conditions like heart disease and hypertension and myocardial infarction, and especially for those folks who are elderly or those who are working outside with extensive exposure. We also know that poverty has been clearly linked to morbidity and mortality during heat waves. We've seen that in Philadelphia in particular. We are a very poor city in general, among the poorest of the large cities. And when we look at environmental circumstances beyond poverty, this map shows the heat vulnerability index, and we see there is a wide variation in neighborhood vulnerability to heat. And some of those other factors include greening and the amount of impervious surface, in addition to poverty and other factors. And so today, we're really here to talk more about children and the effects of heat on children before and after birth. So I will stop sharing my screen and introduce our first speaker as he's beginning to share his. Our first speaker is Dr. Timothy Nealon, a neonatology fellow at Children's Hospital of Philadelphia. Dr. Nealon started his career at Trinity University with a Bachelor of Science in Biochemistry and Molecular Biology, and then received an MD from the Ohio State University of Medicine, College of Medicine. Dr. Nealon came to Philadelphia to Children's Hospital of Philadelphia for his pediatrics residency and pediatric chief residency. He's been a fellow in neonatal and perinatal medicine since 2021, and his research interests are centered in premature birth and adverse birth outcomes. Dr. Nealon?
Thank you so much for that introduction. I really appreciate it. So hi, everyone. My name is Tim. I'm a NICU fellow here at CHOP. And for those of you who don't know what neonatology is, I don't blame you at all. To give some context for that, as neonatologists, we deal with the care of infants, particularly infants who are born too early. So I feel really lucky to work in a field where I get to take care of sick babies in the hospital, and research and understand the relationships of the environment and health outcomes of babies who are born too early, as well as the risk factors that lead to their preterm birth. And so today I have had the pleasure of talking with you during Penn Climate Week to discuss the health implications of heat and climate change. Specifically, I'll be talking to you about how exposure to heat and extreme heat affects different birth outcomes. It's important to note, as Marilyn said, that life doesn't happen in a vacuum, and heat exposures can vary wildly across the same city and zip code, as you saw in some of those previous maps. We'll discuss the interplay of the neighborhood with these things, and also discuss some potential interventions to help decrease extreme heat exposure and improve infant and maternal health outcomes related to extreme heat exposure. This summer was hot to the extreme. If you read the news, listened to the news, generally just stepped outside, chances are you thought to yourself, wow, has it always been this hot? And the answer is no, unless you were born in 1880. It's hot, and that has serious health implications for both moms and their children. I'll first note and kind of just go with a couple of definitions to hopefully help give some context for the rest of this talk. And so the EPA defines a heat wave as 2 or more consecutive days with a daily minimum apparent temperature that exceeds the 85th percentile for days in July through August from 1981 to 2010 for a given city. And I want to draw your attention to 2 things with this. And first is that they use a definition of relative temperature. So that is to say that it's not the daily maximum temperature or daily minimum temperature. It is relative to the 85th percentile for days in hot months. And the second, that they use a measure of apparent temperature, which takes humidity into account. And this is important because without cool nighttime temperatures, the body has trouble cooling and more strain is placed on the cardiovascular system. High nighttime temperatures have been shown to be more strongly associated with mortality than daily maximum temperatures. However, all heat exposure does appear to either not be great or associated with adverse health outcomes. And so this graph on the left shows data that's collected from the EPA from 1961 through 2021. And as you can see, heat wave frequency and length of heat wave have both increased over this time period. And just as importantly, the heat wave season has increased dramatically. That's to say that we're experiencing extreme heat for a greater number of cumulative days and months every single year. And lastly, it's getting hotter. So the graph on the left shows the percent of land area in the United States on the y-axis, and on the x-axis, it's the year. And as you can see, more and more parts of the country are experiencing higher high temperatures and higher low temperatures since 1980. And that has really important health implications that we'll get into. And for some background, let's first talk about preterm birth and what that means. And so preterm birth is defined as being born alive before 37 weeks of pregnancy are completed. This is further subdivided into different categories of severity that range from extremely preterm birth at less than 28 weeks to late preterm birth that's 34 to 37 weeks. Preterm birth is multifactorial. There's evidence to suggest that increased stress, whether it be from an infection or something like an environmental exposure like air pollution or extreme heat, is associated with an increased risk of preterm birth. There are also different types of preterm birth. And so there's a subset of people who will go into preterm labor spontaneously. There's also a subset of people who, due to illness or dangerously high blood pressures or organ failures, will be forced to deliver their infant early. And once you go into preterm labor, there are a number of different interventions that we can offer, but none of them are perfect. And sometimes the train has already left the station. So if we care about about infants being born early, because it has serious health implications for both the infant and the mother. And so I'll first just draw your attention to a paper that came out recently in JAMA. And so for those of you who don't know, for context, JAMA, or the Journal of the American Medical Association, is one of the most highly vetted medical journals in the country. And as such, it takes usually a really large study to be published within the journal. And so this is a recent article from the JAMA family of journals that investigated associations of heat exposure and preterm birth, low birth weight, and stillbirth in the United States. And I didn't mention low birth weight or stillbirth weight or stillbirth previously, but those are 2 other birth outcomes that are really important and are associated with exposure to stress and differential maternal health metrics. And I want to draw your attention to the right and just to show that as temperature has increased in the United States, that preterm birth has also increased. Preterm birth weight has decreased. And so that is to say that babies who are being born throughout their years were being born smaller as the temperature went up. And the stillbirth risk also drastically increased. That's really important and highlights an important exposure to consider when evaluating perinatal and maternal health. And so the first takeaway, without diving too far into the studies of heat waves themselves, is that exposure to higher levels of overall heat is associated with adverse birth outcomes. And next, I just want to talk about the definition that we use of heat wave and how that pertains to our preterm birth risk. Now, I promise this is more than just a map of Alabama, but I did include the study to highlight the importance of definition. As this study investigated preterm birth risk based on a number of different heat wave definitions. And so in a clockwise direction from the top left, you can see they use 4 different definitions looking at a mean daily temperature that's greater than the 90th percentile, there's a max daily temperature greater than the 81st percentile, or absolute temperatures, so a maximum daily heat value greater than 105 degrees, or a minimum daily temperature that was greater than a set cutoff. If you've ever been to Alabama before, it doesn't take a weatherman or a doctor to tell you that it is hot. But you can see from this map that of zip code level data in Alabama that it really depends on what the definition that we're using is to define what a heat wave is and to define what your exposure at risk is. And so you can see if we use a definition from the top left where a mean daily temperature greater than 90th percentile for greater than 2 days, essentially the whole state of Alabama has experienced a heat wave. Whereas if we use the definition in the bottom left, it's really only the Gulf Coast that experienced a heat wave. But in this study, these graphs show the percent change in preterm birth risk and non-accidental death risk of the infant as well by heat wave definition. And I apologize for how small the labeling is on the bottom, but the first 2 models, and so if you look in the figure on the top left, those first 6 points use a relative definition of heat, while the second 6 points use a absolute temperature definition for their heat wave. And what the study found was that there was an increased risk of preterm birth using definitions of relative heat, as opposed to the models that use absolute heat for their heat wave definition. Similarly, there was an increased risk of non-accidental infant death in models incorporating a relative heat wave definition as opposed to an absolute temperature definition. And so the takeaways I want you to come away from with that is that the definition is incredibly important. And there seems to be something different about how our bodies handle changes in temperature from the norm and how the stress that creates, as opposed to prolonged exposure to consistently high levels of heat. And so think about living maybe in Phoenix for the whole year, where it seems to be hot all the time, versus living in Seattle and experiencing a stretch of days with abnormally high temperatures. To further expound upon this, this is a study from Australia that incorporated different heat wave definitions as well, that you all used relative temperatures that either exceeded the 90th and 95th percentile and either the heat wave duration was either 2, 3, or 4 days. And as you can see here, overall, there was an increased risk of preterm birth. And that was actually most predominant for the definitions that used a higher threshold of greater than the 95th percentile for the temperature that one was experiencing. And so that was the heat wave definition 4, 5, and 6 was greater than the 95th percentile for either 2, 3, or 4 days. These figures are from that same study and essentially show that the risk of spontaneous preterm birth based on extreme heat wave exposure in each month of pregnancy. And as you can see that as we look at all heat wave definitions, that there's an overall increased risk of preterm birth throughout pregnancy. And it really depends on the type of definition that you use to say if there is a particular window of exposure that is higher risk than the other. But the thing I want you to take away from is that exposure to heat waves was associated with an increased risk of spontaneous preterm birth. This same study also looked at stillbirth as an outcome as well. And they found that the risk of stillbirth based on extreme heat exposure was increased earlier in pregnancy, as opposed to the last trimester or the last month of pregnancy. And so to further pull this thread along is can the heat-related risk of preterm birth be modified? And so I want to show the results of a study that looked at how different patient characteristics and environmental factors were associated with the risk of preterm birth during a heat wave. And so first, the authors found that heat wave-associated preterm birth was increased among mothers who are older. And so, believe it or not, maternal age is an important factor in preterm birth risk at baseline, and a higher maternal age has been associated with increased risk of pregnancy complications for both the mom and the baby. So this might not be the biggest surprise. Second is that greenness or green space or the amount of trees, grass, shrubbery seem to impact the risk of heat wave-associated preterm birth. This is really important as green space has been shown to be associated with a decreased risk of preterm birth in and of itself. And also, when you think about cities, green space varies wildly within a city. And so if you were to take a walk from Penn's campus and walk straight west, you'll notice a huge difference in the green space when you get past, say, 45th Street. Similarly, if you start in Rittenhouse Square in Center City and you walk north of Temple's campus, it's really eye-opening how differently the two areas look with regards to trees and vegetation. You can also probably feel a difference in temperature as well. And so all this is to say that green space is an important factor to think about as an intervention and as a potential modifying factor for heat wave-associated preterm birth risk. And just to make this relevant as well, if you do read the New York Times, you may have seen an article recently about how Singapore is actually building and creating new neighborhoods to combat extreme heat. And much of the design for the newer parts of Singapore not only use advances in architectural technology, but also rely heavily on intentional green space and the incorporation of vegetation into the city. And so lastly, from the same study, the authors found that both urbanicity and socioeconomic status impacted an individual's risk of heat wave-associated preterm birth risk. And so that's to say that the more urban the area and the lower the neighborhood socioeconomic status, the more likely the individuals in that area were to experience preterm birth as a consequence of heat exposure. And then to further expound upon this point, and then this was a study that explored associations of a 7-day heat index greater than 37 degrees Celsius and birth outcomes. They found an association of race with heat wave associated preterm birth risk, as well as a protective association of higher maternal education with lower heat wave associated preterm birth risk. And what's more is that you can see that the racial disparities that are present in heat wave associated preterm birth risk in both the population of birthing parents with less than a college degree, as well as the racial disparities that are present in birthing parents with more than a college degree. And so to sum all of this up, there are several factors that interact to change a person's susceptibility to extreme heat as far as preterm birth goes. And note how interconnected all these factors are. And note how structural racism, and not race in and of itself, contributes to the differential environmental exposures that then place these moms at a higher risk of giving birth prematurely. And next, I want to begin to end with just a quick word on air pollution. And you may be wondering how these two are connected. It is important to note that there have been steady improvements in ambient air quality in the United States over the past several decades. And a big part of that is a result of public policy that has led to significant public health benefits. However, there are recent trends in ambient concentrations of PM2.5, which is particulate matter that is less than 2.5 microns in diameter, comes from things like smokestacks, car exhaust, wildfires. And we've actually begun to see a reversal in this trend throughout much of the United States. And this was actually a paper that just came out in Nature this past week, in which they found that since 2016, wildfire smoke has influenced trends in annual average PM2.5 concentration in nearly 75% of states in the contiguous United States, which, that is to say that equivalent to essentially 4 years of quality of air progress has been erased. And a large swath of that has been in the Western states. And so wildfire-driven increases in PM2.5 concentrations are actually unregulated under current air and pollution law. And so in the absence of any sort of further intervention, the contribution of wildfires to PM2.5 is going to continue to grow. And that's really important because as it gets hotter and the climate continues to warm, the likelihood that we'll see more and more wildfires as well will continue to increase. And just talk about steps for improving the future, in no particular order. All three of these categories are really important and should be worked upon. And so we first, as a field, must continue to produce thoughtful research, continue to investigate how different definitions of heat and different differential exposures to heat and those how those impact health for both moms and their babies. To think about things like sustained heat exposure and heat wave exposure, acknowledging how relative difference may interplay and affect someone's risk more than an absolute exposure in terms of temperature. And further, it is not enough anymore just to end with descriptive studies, and I believe that we must work towards developing interventions to improve outcomes. And believe it or not, there are a number of different faculty members here at Penn who are working in this space. You'll hear from Dr. McGrath-Morrow next, who's actually one of them, and two others that come to mind are Heather Burris and Gina South, who are actively engaged in setting interventions to improve the lived environment and improve health outcomes. And there are also a number of different community-based interventions that can be championed and grown upon, whether it be equal access to cooling, acknowledging cooling as a human right, or working with the community to improve access to green spaces in urban areas. And then on a policy level, there are numerous areas for opportunity, whether that's legislation at a local, state, or national level, I believe that we're really fortunate to work at a place like Penn that has the resources in place and the people in place as well to amplify these efforts in both public and private sectors. And so we'll conclude, and hopefully if you've taken away nothing else, that extreme heat exposure is associated with adverse birth outcomes, preterm birth, low birth weight, and stillbirth. And it's really important because infants who are born preterm, who you'll hear from Dr. McGrath-Morrow here coming up, to hear how those kind of outcomes in those babies and how outcomes in older kids are really important and kind of connected as well with the situations around their birth. These associations between heat wave exposure as well as birth outcomes are modified, and they're modified by neighborhood characteristics, maternal health factors, environmental exposures. And the structured environment is something that is shaped by policy, is very dynamic, and is really a key contributor to health. And so we'll end on that note. I believe that we're going to hold questions for the end, and I'll turn it over to Dr. McGrath-Morrow.
Great. Actually, before she gets started, let me introduce her. Thanks so much, Tim. Really great presentation. Our next speaker is Dr. Sharon McGrath-Morrow, the Associate Chief of the Division of Pulmonary and Sleep Medicine and leader of the Post-Premi Lung Disease Clinic at Children's Hospital of Philadelphia. Dr. McGrath-Morrow is Deputy Director of the Center of Excellence in Environmental Toxicology. Her educational background includes an MBA from Johns Hopkins and an MD from the University of Virginia. Dr. McGrath-Morrow's research interests are centered in the early life determinants of respiratory outcomes later in life, including bronchopulmonary dysplasia, which she'll talk with us about today. Thanks. Dr. McGrath-Morrow?
Thank you, Marilyn. And Tim, thank you for such a wonderful, comprehensive talk. I think you've done all the hard work for me. So let me just move on. So I have no conflicts of interest. The objectives of this talk is to really discuss, and go into some more depth about the relationship between extreme heat and preterm birth. I'm going to discuss some of the consequences of preterm birth on lung health in children. I'm going to segue a little bit into how air pollution and extreme heat kind of interplay, and it's really a downstream consequence of this global warming phenomenon that we've been seeing recently and how that influences lung health. And then just very briefly discuss some of the long-term respiratory consequences of preterm birth throughout the lifespan. So just to kind of give you some perspective, preterm birth is a huge problem globally. It really accounts for about 11% of all live births, and preterm birth complications are a leading cause of death in children less than 5 years of age around the world. They account for approximately 16% of all deaths in children less than 5 and 35% of deaths in the newborn period. And as you look at this global map from 2019, you can see that there's regional hotspots of preterm birth, and not surprisingly, it's very high in China and India, parts of Africa, but it's also relatively high in North America and in Brazil. And it's not hard to think about how global warming and air pollution are also high in these areas. So what about the United States? Well, in the United States, we have about 3.6 million infants born each year. And about 10.5 of these children are born preterm. Most of them are more late preterm, 34 to 37 weeks, around 7.7%, and there's about almost 3% that are less than 34 weeks. And these are the children that are at highest risk for long-term respiratory problems. So when we look at the map of the United States, and this is from 2021, and this is from a National Vital Statistics report that was just published in 2023. The preterm birth rate rose 4% in 2021 to 10.49%. And this is the highest rate that we've seen since 2007. So what had been happening is we've been having a slow, gentle decline in preterm birth. And then all of a sudden around 2021, we've had an increase. And if you look at this map, there's regional differences in preterm birth. If you look at the darkest green, that's where the states have had the largest increases. So we have had increases in the Northeast, down south in Texas and in California. There's in the towards the Rocky Mountains, really non-significant declines or non-significant increases. So we definitely have certain areas of the country that have shown an increase in preterm birth. And just as Tim had said several times, there's disparities in who's affected by preterm birth. And we know that our non-Hispanic Black mothers are 2 times more likely to have newborns weighing less than 1,500 grams compared to other racial groups. And then if we look on the right side and we look at our Black infants and the prematurity in Black infants and white infants, it's about 14% risk for Black mothers of having a preterm infant. And in terms of the very low birth weight infants, which are the children who are at highest risk for pulmonary and other problems from preterm birth, is about twice, almost 3 times the amount of what happens in white mothers. Okay, so that it's not just preterm birth, but there's also disparities by race in neonatal mortality. And we know that neonatal and postnatal mortality is also highest in our non-Hispanic Black infants. And you can see that in this, this figure below from 2017. The preterm related mortality, so most of this mortality is due to preterm, much of it is due to prematurity, and preterm related mortality was 3 times higher in our non-Hispanic Black infants compared to our white infants. So what is this relationship between extreme heat and rate of prematurity? And Tim has shown a lot of very nice studies, and I'm going to show you a few. Some of them are the same, but some are different. So, he defined extreme heat and temperature, in his talk, but it's roughly defined as a period of high heat in which temperatures are above a normal average level for at least 2 to 3 days. Extreme temperatures have been defined differently in different studies as being above the 90th, 95th, or 97.5 percentile cutoffs. And so we'll look at that in one study from California, how that can make a difference, how you define extreme temperature. So you saw this before, and this is from the EPA, in which heat wave frequency and average length of annual heat waves in the 2020s have really increased. And if you looked at before pre-industrial era, the pre-industrial era, the probability of heat wave is 2.8 times greater now than it was then. Okay, so what is the impact of extreme heat on preterm birth? Well, we know that mothers who experience extreme heat during the last week of gestation have an increased risk of preterm birth. The risk of preterm birth was 13% higher among mothers who experienced a heat wave during the last week of gestation compared to other mothers who did not. And it's the magnitude of the heat effect on the preterm birth increases with the severity of the heat wave, and the strength of the relation between heat waves and preterm birth increase with duration of the heat wave. So it's really severity of heat wave and duration of heat wave that's really associated with preterm birth during the last week of gestation. So if we look at this study from Soon in 2019, we're looking at different geographic areas across the United States and also the climate zones. And this, if you look over here, we have the fraction of preterm births and percentile that are attributed to extreme heat. And we see the highest fraction in the Southwest, the Midwest, and the Southeast, the Midwest, and the Southwest, and also in our high dry and mixed dry areas. These are the areas where we see the highest number of preterm birth attributable to extreme heat. So this is just another way of looking at it. Overall, extreme heat, when you look at the 95th percentile versus 50th percentile for heat, overall it has a significant relative risk increase of preterm birth. And then if we look at different areas of the country, it's a little bit hot. It's higher in the Midwest, highest in the Southwest where it's extremely hot. And then we see that it's also high in these high mixed and mixed dry. But you also see an increase in the cold and very cold climate zones. And it's very interesting. And it's thought that this may be attributable to a lesser degree of adaptation to extreme extreme heat. So these mothers are less able to adapt to this extreme heat, even if they live in cold climates, and then you have an increase in heat. That can be problematic and may attribute to the preterm birth in that population. So once again, this is from the EPA, in which we're looking at heat wave characteristics in 50 large cities from 1961 to 2021. And as you can see by the dots, the bigger the dot, the greater the change over that period of time. And as you can see, there's sort of, I just put circles around different areas of the country where we're seeing an increase in heat wave frequency, particularly in the Northeast, around Texas, I guess that's Oklahoma, and in California. And so what I wanted to show you was, if we look at this 2021, where we see these increases in these areas of heat and heat wave season, and then we look at our preterm birth rate, which has that actually rose in 2021. These are similar areas. So it makes you think that heat is probably a contributing factor to the increase in preterm births in these areas in the United States. So this is another study in which we're looking at California. And what they did is they looked at 95th percentile temperatures. And as you can see, and these are different, very high increases in heat in certain areas of California. And so they did these different definitions of heat wave definitions from the 75th percentile above a mean expected temperature to the 98th percentile. And they found that the most conservative definitions of heat wave was associated with the greatest risk of preterm birth. And so you can see these hazard ratios where if the duration was 2 days, it was significant. If it was 3 days, it was even more significant, and 4 days or more, it was most significant in terms of its association with preterm birth in the last week of gestation of this mother. So, Tim talked a little bit about this, and this is, long-term sort of ways of modifying the effect of extreme heat on prematurity and other health outcomes. Something that we could implement, relatively quickly would be if we start really having these extreme warning systems, particularly for these pregnant mothers, if they could get out of the extreme heat, potentially that could, particularly, ones as they go further into their pregnancy, that may help with some of these preterm births due to heat. So I'm going to segue a little bit about what are the downstream consequences of preterm birth on lung health. And so I was just going to talk a little bit about bronchopulmonary dysplasia. I'm a pediatric pulmonologist, and I work with these children very closely. I also work with children with asthma, and I'm not a neonatologist. So my work with these children is, some of it's inpatient, but most of it is after they go home. And, just to kind of let you know what this disease is, it's really the most common chronic lung disease of infancy. We know that about over 10% of our children are born preterm. The ones that develop chronic lung disease like BPD are usually the ones that were extremely low birth. And it really affects their airway growth. And if you look at this histology slide, this is normal lung, and this is the lung of a child with severe bronchopulmonary dysplasia. As you can see, there's very little surface area of the lung. So many of these children are on supplemental oxygen. Some of these children actually have to are on positive pressure ventilation even after they go home. And the effects that occur in early life can have a substantial effect on the respiratory health throughout their lifespan. And this is just showing, some imaging of their lungs early on in life. You can see these very numerous cystic changes. And this is a little girl that I follow who's at 9 years of age, and she still has these changes in her lung. And you can imagine that these kids may be at risk for early onset COPD that we see in our adult population. So these are some of the factors for BPD development, prematurity being the #1 factor why these children go on to have lung disease. And And so we also know that race is a factor that influences preterm birth and mortality and morbidity, as I talked about earlier in my talk. So if we look at Philadelphia, we know that our infants of Black mothers born in Philadelphia have a higher incidence of preterm birth. About 14% of all live births from Black mothers were low birth, compared to about 6% of live births from white mothers. And additionally, 3% of all live births from Black mothers are very low birth weight, with less than 1% in our white mothers. And if you look at this, and I think Marilyn had shown this earlier, here is here's Philadelphia, and here are predominantly Black neighborhoods in red, predominantly white neighborhoods in blue, and others in green. And if you look at the areas of heat islands, we basically see the most predominance of heat islands in the neighborhoods that are predominantly Black. And so we don't really know directly what influence extreme heat or heat islands has on the preterm birth, but we know that the Black neighborhoods are vulnerable populations anyway for preterm birth, and it's very likely that it contributes to our high numbers. This is a study from California, and I just wanted to, once again, the heat wave season has increased, particularly in California, as did the preterm birth rate. Around 2001, we started seeing an increase in mortality in our extremely low birth weight children who were Black compared to our white children. And we wonder about some of these social determinants of health, how this may be influencing our disproportionately our Black children with regard to both premature birth and neonatal mortality. And then when we follow these kids, this was a study done by PROP looking at preterm children. They found that during the first year of life, non-Hispanic Black infants were more likely to have respiratory symptoms compared to our non-Hispanic white infants. So what's the estimated respiratory burden of prematurity? It really has a substantial impact on the U.S. We know that about 50,000 babies have BPD each year. About 12,000 go home on supplemental oxygen. About 200 go home on home ventilators. And probably about 66,000 of these children will go on to have childhood asthma. So global warming increases outdoor air pollution, and global warming is also associated with increases in the pollen season length and pollen concentration. So it probably has an adverse effect on children with allergic diseases. Similar to asthma, BPD is also an airway disease. So if we're having more pollen, we're having more particulate matter, that's also going to have adverse effects on these children as they age. And this is just to remind us that our particulate matter can come in different sizes. If this is on the right side, a piece of hair, our PM 2.5 can actually get into our alveoli. The PM 10, which are the largest, will get into the upper airways, and the PM 2.5 to 10 goes into the airways or the small airways of the lung. And fine particle pollution can cause a lot of problems in the lung. It can have an effect in fetal life by reducing growth. It's associated with infant mortality and wheezing in infancy, development of asthma, and other respiratory conditions. And this, Tim actually showed this, but I also wanted to show also the effect. This is a systemic review. This shows the effect of heat, which he had already showed you, the increased risk of preterm birth, low birth weight, but there's also an increase with air pollution exposure, both with preterm birth, low birth, and stillbirth. So the combination of the two are really problematic. And there's models that estimated that almost a third of all preterm births globally could be attributed to total PM 2.5 exposure, accounting for over 5 million of the preterm births born each year. And this, once again, we have this global map showing where the highest levels of 2.5, and some of them really look like where the extreme heat and the heat waves are also occurring, and the preterm births. So, this is also a problem with traffic. I'm not going to go into this study very much, but I just want to emphasize once again, Black children are disproportionately affected by being closer to highways. We know from this study that for every kilometer in distance between a resident and major highway, the likelihood of activity limitation was decreased by 35%. This is just a picture I took. I probably shouldn't have taken this picture. I was driving home on the Schuylkill in June during that the wildfires, and this was usually there's beautiful blue sky, and this is just horrible nastiness from the wildfires. And when you look at the PM 2.5 in Philadelphia during that time, it spiked from these low levels of less than 20 to over 160. So one of my colleagues and mentees is actually measuring indoor air pollution in some of our children with BPD. And she found at the same time that the outdoor air pollution was spiking, she found a spike in her indoor air monitors, which is really problematic because, you know, we think that going inside is protective, but actually, even if you go inside, you know, there's very high levels of PM 2.5 from these wildfires. So you're not completely protected from going inside. And then this is just a study we recently did looking at the effects of outdoor air pollution on steroid use and acute care usage in children with bronchopulmonary dysplasia. And once again, the children that were in the high pollution areas were more likely to be Black and have lower medium income. And they were much more likely to have emergency department visits and use of systemic steroids for respiratory exacerbations. This was also a study done by Jelte Kelterman, one of our former fellows, who's now attending, who looked at asthma exacerbations being associated with spikes in ambient air pollution. So, so one of the questions about indoor air pollution, if we're seeing that as a result of wildfires, we know that secondhand smoke is problematic for our children with BPD, disproportionately affects our Black children and our children that have public insurance. How will these increased indoor levels of PM 2.5 caused by extreme heat and air pollution affect our children with BPD? We know that secondhand smoke is problematic, and now we have this concern about higher levels of indoor air pollution due to wildfires. So just to finish up, an estimated 25% of our adults with a history of BPD will have chronic respiratory symptoms in adult life. And we know that lung normally will decline after about age 21. And if you reach a certain low level in lung function, you will develop chronic obstructive pulmonary disease. And we know that there can be cumulative effects, both from preterm birth, respiratory illnesses, environmental exposures that can accelerate our decline in lung function over our lifespan. So this is a concern that extreme heat may play a role in this. So my take-home messages are that heat and ambient air pollution can increase the likelihood of preterm birth. Effective interventions are needed to lessen the burden of heat and air pollution on the respiratory health of children, particularly those with BPD and asthma. And preventing preterm births due to heat and air pollution will potentially, I kind of said this wrong, by not preventing preterm births due to heat and air pollution will potentially increase the number of adults who develop early onset chronic obstructive lung disease. Thank you.
Thank you so much. Let me have you stop sharing so we can see hands. Great. Thank you. Thank you both so much. Those are great talks, and I think we gave us so much to think about. I'm going to start with the first hand that I see, Dr. Iser.
Yes. Can you hear me?
Yes.
Okay. I want to encourage these scientists to look under the hood of heat, specifically when you're in a hot environment, you tend to consume more water. And if the water is contaminated with toxins such as lead, then you consume more lead, and then you have higher lead toxicity. If the person is a smoker, then you also have cadmium as a risk. Or if there's even just secondary smoke, you have cadmium as a risk. So these two well-known toxins both are major risk factors for the development of preeclampsia and other other complications of pregnancy. I mean, it's possible these are the major causes of complications of pregnancy. There is an ACOG policy regarding lead testing, which is totally inappropriate and unimplementable. And that if it's changed so that the lead toxicity is noted, then there are things one can do during pregnancy, so you're not then dealing with bronchopulmonary dysplasia. Thank you.
Thank you.
That's a great point. And it occurs to me that maybe there's a pilot project in the offing there of lead testing pre and post heat wave.
Mhm.
Yeah.
Yep.
Yeah,
It's a really
definitely.
good idea. Thank you.
You're welcome.
Any other thoughts? Well, I have a question. You know, Tim, perhaps I should have heard this before, but I liked your comment about cooling as a human right. And I was wondering is there any place where cooling is considered a human right? And what are your thoughts about that?
I think that is a great question, and thank you for asking that. I was actually doing some research, and it turns out that there are countries, and actually Singapore is the one that came to mind, where they have revamped part of their city and society to kind of prioritize cooling and kind of give access to cooling for their inhabitants. At least that's how it was being kind of painted with the scientific articles and the lay news articles that I was reading. I do think that's also a bit of a catch-22, right? Because to cool, you have to use an air conditioner, which is great. And so we want to kind of decrease those extreme heat exposures, or at least have a warning system. But then kind of using more air conditioners does create more electricity use, and ergo kind of more, like, increases kind of your pollution as well. And so I think that there really has to be work towards kind of making a more sustainable future with regards to energy as well, in conjunction with kind of making cooling a human right.
Good point. You know, I think we all energy is not the same. All pollution generation is not the same. So here we would be trading local improved ventilation for a vulnerable population with the added regional or larger geography. And so those are trade-offs that I in general think are good to make.
Yep.
From a health
Agreed.
perspective, especially
Agreed.
thinking about individual health. But you're absolutely right. Obviously, the best case scenario would be for the energy to be clean from the start. Any other questions?
So Marilyn, I would say that we can't afford not to do this, because these children that I was talking about, I mean, they're not only suffering, but their economic cost of their medical care and their long-term health, care is incredibly high, and it also has sort of off effects on economics, because a lot of times these families can no longer work. And so they're no longer contributing to the, economics of the country. I mean, there's just so many downstream effects of not caring for these protecting our vulnerable, protecting our pregnant women, protecting our children. I think that we have to do something.
Absolutely. And I think your data really was very compelling when we think about all of the social determinants of health engaging with these climate issues, both the air pollution and the heat, and how they all really work together in a cumulative way to really erase some of the improvements that we've made in some of these issues, in particular air pollution in the past. And I think that is, we kind of like as a society think, oh, we've made improvements on that and that and that. But the fact is, we can actually erase those improvements. And sometimes our environmental circumstances, like those that come to us through climate change, are tending to erase some of those very important health improvements that we've made. and it's really that needs to be figured into some of the calculus as people are considering cost benefit analyses.
Thank you so much. Thank you for sharing such compelling data to both of you, to both speakers. To follow up on Dr. Iser's question, comments, I was wondering how much of the mechanism are known, and whether you could comment on like the interaction between the temperature and the pollutant levels.
Yeah, those are really good questions. And I think we're very early on in understanding. I mean, the PM 2.5, the air pollution, I think we understand that a little bit better in terms of the direct effects it has on lung function. It's certainly, we're currently looking at susceptibilities, genetic susceptibilities, because we know that not everybody is, everybody's harmed by certain levels of air pollution, but it's sort of a dose effect. And we know that, certainly our vulnerable populations are much more susceptible to the adverse effects of, PM 2.5 and some of the other air pollutions. In terms of heat, it's interesting because I think in terms of the pregnant women, I think it's this, they're going through a lot of changes during, their pregnancy. And I think there's different metabolic changes, and the heat has an adverse effect, particularly as you go further into your pregnancy. And I don't know if Tim wants to comment on that or not. I think and then the interactions between extreme heat and air pollution. The obvious ones are the wildfires, because they're going to create lots of 2.5 and PM10, but there's probably other interactions, the increase, changes on metabolism in the body and that sort of thing. I don't know if you want to comment, Tim.
Yeah.
What's going on with the pregnant women?
Yeah, and there certainly are, and it's also multifactorial. And so we talked about one in terms of spontaneous preterm birth and spontaneous labor, and that having something probably to do with kind of increased inflammation due to kind of this toxic stress exposure of an extreme heat or air pollution, which is a little bit better delineated. But then again, you have medically indicated preterm birth, and so kind of those are kind of moms with maybe preeclampsia, or other health issues where there's kind of inflammation, oxidative stress, some maybe endocrine disruption as well, that sets off a cascade of events that can then kind of predispose a mom to delivering preterm. And so it's all interconnected. And I would also stress that the pathway for kind of heat exposure to kind of spontaneous preterm birth is potentially different than that of heat exposure to medically indicated preterm birth as well. And I think really depends on other environmental exposures and mom's risk factors.
We recommending air conditioners and air purifiers for people who can afford them? And if so, what kinds of public policy do we need to be working on to actually make these kinds of technologies available to everyone?
Yeah.
And
yeah, go ahead, Tim.
I was going to completely agree with what you had said earlier. I think we can't afford to not do those things. And I think you need to work on multiple different policy levels to try to do that on a broader spectrum as well. And it's going to take more than just individual level interventions to hopefully help reverse some of those trends.
Yeah, I think there's more and more evidence suggesting that, not that I'm a proponent of air purifiers, but I will say they do seem to help in some circumstances. There's a lot of barriers to air purifiers. They're not cheap, and you have to replace the filters, every 3 to 6 months, and they're expensive. The filters themselves can be quite expensive. So I'm not really sure, where, how acceptable that's going to be in terms of cost. But I am a believer that could be one intervention that may help. I mean, it's not going to be, the whole thing, but it could help.
I just want to point out that there is a wide variation in based on when housing is built, how tight it is. So a very old house will have many natural air exchanges through its windows and cracks and all that, whereas a house that's built much more in the last decade may be much tighter. And so it's probably also a different answer for each vintage of housing. when it comes, and that may be one of the questions we need to include in our exposure assessment for patients about, what kind of housing do you have?
Mhm.